12 months. That's a long time. A lot of women get a little tired after 6, so understandable. But there's also some research as we get a little farther in. I don't think I want to break that out yet. I'll wait on that. So male infertility facts. Let's talk about the men, then we'll talk about the ladies. Usually we try to do ladies first, but sometimes we'll make it even. About 10% of the men in the United States who are attempting to conceive suffer from infertility. So that's quite a bit when you think about it. 40% of the infertile couples, the male partner is either the sole cause or the contributing cause. So this is about 1 in 5. So quite a bit of difference. So a lot of times I get ladies coming in and they'll actually say my husband has low sperm motility, but we're okay, everything's fine. Well, that's not okay because it takes 3 months to make new sperm. So if you have low motility, that means something's damaged, something's wrong. So we need to figure out how to make that. So 1 in 20 men actually have a low sperm count, and 1 in 100 actually have no sperm in their ejaculate at all. You don't really think about that, but that does happen. And I was like, wow, that's actually a pretty decent number compared to how many men that I actually discuss with the ladies with what's going on. Women, okay, age 15 to 44 with impaired fertility is 12.1%. Married women that are aged 15 to 44 that are infertile, 6.7. That's kind of high, kind of scary. Women who are aged 15 to 44 who have ever used infertility services, so this could mean actually in vitro, it could just be assisted where you're using Clomid or other things, that's 7.3 million. So this is obviously a very big industry. So one of the things that we really work towards is how do you just be healthy? So women aged 15 to 44 have ever used infertility services, as well as at 12% of those, so 7.3 million is 12% of those. Kind of crazy. Infertility risk factors. Now there's a lot of things that can cause infertility. One of the big things that I really want my patients to focus on is no matter what, diet makes all the difference. Food can change a hormone cycle in just 1 month. And men don't tend to see it as much because they don't get that great monthly check-in, and I know women look at me like I'm crazy when I say your period is a wonderful time to have a check-in because they're like, I hate this thing. I'm like, but it's really good because if you have a lot of symptoms, we didn't manage things very well. We haven't done well with our diet, maybe we're low on nutrients, didn't get enough sleep, we were sick. Some of those things affect that. So it's wonderful to have that monthly check-in. If that monthly check-in isn't going well, we can always change it. So very important to think about food. Really one of the big things, as you see on here, disruption of testicular ejaculatory function. Varicocele could be one of those. Varicocele, think about varicose veins in our legs. Men can get those in their scrotum. So that can actually be taken care of with surgery and actually can help change the outcome for men as well. Trauma to the testicles. This always comes up when you think about the little kids on the playground and how many times the little girls try to kick them. Not necessarily a good thing. Always something for all those little girls out there. Don't kick boys. So low sperm count is obviously an infertility factor. That's pretty common. Elevated temperatures. Now this one's pretty interesting. A lot of people don't realize that the average temperature within the scrotum is 93.2 degrees. Normal body temperature should be around 98. For every temperature above 93.2 in the scrotum can actually decrease sperm quality by 40%. That's a lot when you think about it. So that goes back to when they sit with a computer on their lap, that does heat up the testicles. When you put your phone in the front pocket, that heats up the testicles. There's absolutely some really good info. There's actually a German company out there that's so worried about this that they are now making underwear that blocks EMF. So, they're worried about their sperm counts, which is good. Unhealthy habits such as heavy alcohol use, smoking, and this can be cigarettes or marijuana. Now, don't ask me about CBD oil because there's not enough studies on that to tell what it does to the testosterone or the sperm counts as of yet. Anabolic steroid use, everybody knows usually when somebody's injecting anabolic steroids, testosterone goes down. And so does then your ability to form sperm. Illicit drug uses should be also another, okay, that makes sense. Environmental factors, heavy metals. So if somebody works and they're in the car industry and they're spray painting cars, so they're a body shop and they work with paints, they're also getting a ton of chemicals in them. You know how many guys I see in there that usually are just walking around even after they're spraying? They may not be the ones spraying, but they're walking around without a mask. That's toxin. Toxin load is big. We are not sure why all of these things are really going on the rise, but we know environment is huge. So we have to look at what somebody does for a living as well to make sure that they're not environmentally overloading. So this can also mean another big thing that has popping up a little bit more in the news, that as we're listening to podcasts and stuff, goes back to molds in the house. So if you actually have condensation in your windows or you notice molds, that can be an environmental toxin that can change how your hormones function and to decrease sperm function and ovarian function. Cancer treatment involving the use of chemotherapy, radiation, or surgery. That's very common. A lot of times if somebody has to undergo cancer treatment, they'll actually have somebody, they'll do a sperm donor before that, so then they have that for later in vitro. Medical conditions such as diabetes, cystic fibrosis, autoimmune disorders, infections, of course, will affect that. Obstruction. The one thing that is actually not on here with the retrograde ejaculation basically means it goes back in to the bladder. So that can actually create infections as well. But that is not on here is obesity. They actually say that obesity decreases your sperm counts by, I think it's 12 to 40% depending on the BMI. Female infertility risk factors. These are really important because we talk a lot in this office with fat and excessive fat. We talk a lot when you have a high amount of fat, usually over 30% of the body weight being fat, then what you're doing is actually producing more aromatase or inflammatory estrogen, which is more like your cancer-causing estrogens, your 4-OHs. So that's problematic because then it starts to drive an inflammatory cycle. So we want to try to arrest that and get that excessive down. Now, if you're too low on fat, cholesterol is the backbone of estrogen. So how do you make these hormones without good fat? So if you're losing fat or you're not getting enough fat in your diet, you can actually create your own infertility issues as well. Chronic diseases, same with ladies. So autoimmune diseases are a really big one that you'll see. Multiple miscarriages, 2 or more early pregnancy losses. I've seen patients with as many as 8 come in, and still we've been able to have a live baby. It does take time, so it just don't expect things to happen overnight with most of these. Tubal disease, STDs, fallopian tube blockages are another big one. Surgery for ectopic pregnancies, abortions, or appendix. Endometriosis is a big one, and we're going to talk a little bit about this a little farther in because endometriosis has kind of stumped some of our communities for a while because endometriosis basically looks like a spider web sitting over the uterus. Like, why on earth is it tacking it down? So it's making it really hard and inflamed on the inside, but then holding everything down. So we'll talk a little bit more about that. Cigarette smoking can definitely affect alcohol, especially for neural tube defects. Exposure to workplace hazards and toxins. Just like gentlemen, we can run into the same issues that men can have. So this is where you get the hormonal imbalances. When you have periods that last more than 6 days, that can be problems. If you have shorter cycles, heavy periods, lots of clotting, longer than 35 days apart, so oligomenorrhea, irregular, unpredictable, everything. Excessive facial hair, that's something that usually goes with polycystic ovaries, which I'll also cover. And of course, as we know, the older we get, the less likely it is for us to become pregnant, or we may be a high-risk pregnancy. Now, I've seen more and more ladies over 40 with babies and no issues whatsoever. I think this one really depends on how well you take care of yourself, for sure. So the infertility causes of females. Most everybody knows about polycystic ovaries, right? So we're going to cover that a little bit. Endometriosis is the next big one. Birth control can actually affect pregnancy. Some research you'll look at will say that somebody who's been on birth control for up to 5 years within the first year is 12% more likely to have a baby. Some people, depending if you're a genetic snipper, if you have an MTHFR defect and you're on birth control, that can actually create infertility issues because you don't get rid of that excess estrogen that comes in through the birth control because you don't have don't usually carry enough B12 or folic acid in your diet to take care of this. It also makes you very folic acid and B12 deficient, that they don't tell you when you start taking it. So it's like if they just told you to take some, it would a lot of times help to prevent that. Adenomyosis is something that we don't really talk about. It is actually confused a lot with endometriosis. This one is really a hard one because basically what it is part of the uterine tissue has broken out. So the only way to really find this is through it's not even an ultrasound, it's a histopharyngo, I always say it wrong, so it's called an HSG. So basically what they do is they go up there and they can shoot saline up there, or they can do a dye, or even they can run x-ray up there and you can actually see the damage to the tissue. Usually with this one, the downside is most often the cure for it is a hysterectomy. So not really a great one. But this one has the exact same symptoms as endometriosis. Kind of scary. Fibroids. 5 to 10% of infertile women actually have fibroids. Fibroids are usually a benign tumor, but when you have fibroids, why are you producing them is the question. Because usually when these things come up, something's happening that you're producing incorrectly. Now, another interesting side note, like I was reading a little bit more about cholesterol, because cholesterol to me is always interesting, because when you look at, I get a lot of people that come in and say, oh, I have high cholesterol, so my doctor put me on statins. Well, do you know that usually when you have high cholesterol, it means that something's going wrong with your body, so your cholesterol is actually trying to go out and heal it. So really with ladies, they also notice that if you take their cholesterol levels around ovulation time, it will always be higher because your estrogen is rising and the backbone of cholesterol is estrogen, or backbone of estrogen is cholesterol. So it will be higher at that time. So a lot of times they want to try to take it more at the end of your cycle. Now most doctors aren't following that because that's more new research, but something if you ever have to have your cholesterol done, request to have it done around your period time. Okay? Endometriosis. So this is an inflamed uterus. Looks fun, doesn't it? That looks happy. I want to have that. I don't want to have this. This looks like an angry monster trying to eat me. So it burdens 6 to 10% of the ladies out there. Chronic inflammatory, as you can tell, usually red means inflamed. Usually they say it's benign. I don't know how this is benign. This is painful. This hurts. Mainly the reason they say it's benign is it's not cancerous. This definitely has a genetic component. Like if you have somebody in your family, usually a lady, then it's most likely going to be a possibility for you. One of the newer things that have come out is we used to do endometriosis and we used to give birth control thinking like this is going to help because we thought we needed to support and balance out the estrogen levels. But what they're finding is the proliferation is due to progesterone resilience. So almost like a diabetic has insulin resistance before we get into the diabetic stage, endometriosis now is showing up as progesterone resistance. Now, also, interesting thing about endometriosis is these guys have a lot of gram-negative bacteria in the cervical mucus, which means the microbiome is off. So we think of that as small intestinal bacterial overgrowth or low lactobacillus acidophilus. But as you work with this, if you can get a doctor to actually give bioidentical progesterone for 3 months and then work with the gut, a lot of times you can actually do some reversal of this cycle. So it's really neat. That's new emerging science that just came out within the last year. So kind of exciting to actually see something that might help endometriosis more than just what we've regularly been doing. So, and the other thing that we are also noticing is that it's an immune system disruption. So CD5/6 positive cells are actually immature natural killer cells. So your natural killer cells are set up to go in after inflammation to take this inflammation down. So what they're seeing is we have some immature natural killer cells here, but they've never matured. They're not actually going after it to take care of the inflammation that's there. So your T cells are dysregulated. So your T cells help to regulate your internal and your external environment. So think of when you have allergies to hay or hay fever or grass, things like that. You get the runny eyes, the runny nose, itchiness. That's basically a T cell dysregulation. So they're thinking that you're getting a T cell dysregulation. Now they haven't actually put this into an autoimmune disorder at this point because they don't necessarily believe it's an autoimmune. It's not the body attacking itself. It's just a dysregulation. The immune system doesn't know what to do. So there's some research that's starting to learn what can we do to test to get better ideas of who has endometriosis and what's happening with them. So they're actually looking into cervical mucus testing for that to find out, can we look at if there's any progesterone in there, is there gram-negative bacteria, what can we find to help these ladies? Estrogen, estradiol, which is E2, the most common one that's in any lady who's not menopausal, stimulates the growth and inflammation of the ectopic endometrial tissue. So this is usually 2-OH or 4-OH estrogen, so that's your inflammatory estrogen that's growing that. So E3 is common in pregnancy, E1 is more common in menopause. So this is our primary, but this could be 2, 4, or 16. OH, 2 is very protective for the body because estrogen is meant to be naturally anti-inflammatory. Now, it gets a bad rap. It is not that bad of a guy out there. We want estrogen. Estrogen is good for us. The problem is with different pesticides and chemicals, plastics, parabens, they actually increase our estrogens, but in the 4-OH realm, which is more of your cancer causers. So it's creating a lot of inflammation. So that's one of the things that we want to try to take out. Like when we talk with patients, it's a lot about, let's talk about what you're using to clean your house. What are you cooking with? What do you store in? What do you put on your face? What do you clean your hair with? Because all that can affect your hormones. Now, in functional medicine, my first thing that I always go to is go to the gut to heal. Because the hormones, when I look at that, I'm going with the gut, the liver and the bile, and then the adrenals and the thyroid, and then the blood sugar, the immune system, the brain, all of that. And hormones are the very last piece that we really will touch on. So when I have a lady come in with hormone problems, I don't start with hormone issues. I actually go back to the gut, work with the liver, because if you are not detoxifying out these estrogens, because once the estrogen is done, it goes right back to the liver to be excreted or broken down, right? So if you don't have the right methylation factors, B6, folic acid in the methylated form, methylcobalamin, then basically it gets recycled into inflammatory estrogen and stuck in your fat. And that's why some people will complain that, when they get around their cycle, they have breast tenderness or they have cramps or they're very moody, they're craving food. That is your inflammatory estrogen talking back at you. So very important to kind of think about the whole picture as you go through. Polycystic ovary syndrome. Another one of the most common endocrinopathies affecting women. Between 8 and 13% of reproductive age women struggle with PCOS. Now, one of the things, and I like to point this out because this is big. Like a lot of times they'll say, well, you're not PCOS because you're not overweight. Well, only 53% of people deal with weight problems. So I have a lot of thin ladies that come in, they have a vaginal ultrasound that has proven that they have PCOS. But nobody wants to do anything about it because they're like, well, you're not struggling here. Like, no. This is blood sugar dysregulation right here. But it's also blood sugar dysregulation and polycystic ovary syndrome. But it's usually blood sugar within the uterus. It's not able to regulate within that muscle tissue wall its own blood sugar. Okay? Irregular menstrual cycles, very common with PCOS, but I do have a lot of ladies that come in and they're very regular as well. They just complain of pain. Infertility is 44.5% of the time with your PCOS, even though it's only 8 to 13% of the reproductive age women. Hirsuit is basically facial hair. So a lot of times you'll see ladies with facial hair. That is a big sign of PCOS because that basically means your testosterone is too high. Men are supposed to have facial hair. They're supposed to have chest hair. Not all of them have back hair, but some of them have back hair. But these are the things you actually see with some of the women that are really far along into theirs. And the big thing is arresting that cycle and getting the testosterone down and turn it back into estrogen the way that it needs to. So how do we regulate that blood sugar? So there's a lot of things you can do with these. All of them start back at the diet. It's so much important to think about what foods am I eating. So if you don't want to change your diet, you're probably going to end up in an infertility clinic. 20 to 50% of your polycystic ovaries have normal cycles. So I have a lot of those that come in. 80% to 90% of the women with oligomenorrhea, basically missing periods. It could be once every 3 months. It could be once every 6 months. And they also have elevated levels of free testosterone, which goes back to facial hair. Anytime you increase testosterone in a female, you are going to increase the risk of diabetes. So that's where the T2D is type 2 diabetes. So I put in some testing all the way around for both males and females. For males, one of the most common things they'll do is a semen analysis. Let's see what kind of swimmers do you have. Do you have good motility? Do you have a lot of broken swimmers? So this one becomes really important because if we have low motility and it takes 72 days to make a sperm, that motility isn't going to change until you start changing things, and it's going to be 3 months. So it could be usually with my patients, and I'm dealing with men, I tell them 6 months, and then you can really think about, okay, how are we doing? Because at that point, I know that I've been able to discuss with you the EMF with the phones, the heat, weight, diet, overall, and there's a lot of things that it takes to make sperm. Most people don't really know this, but we do zinc testing in the office, and the main reason I do zinc testing is it's very important for building hormones, helps the immune system, deals with skin cells, right? So one ejaculation in a gentleman depletes the zinc. So if he's not getting 20 milligrams a day in his food, he just blew it all. And each time, that zinc is actually what helps to mature good semen. So if you don't have enough zinc, then you're going to continue to get low motility. So sometimes it's just as simple for some of these guys as just adding good nutrients and helping them along. So physical exam or an ultrasound for varicocele is something that they do recommend testing. Hormone testing isn't done as often on gentlemen. I do recommend FSH, LH, and free testosterone testing when you're looking at that, because anywhere in this pathway could be thrown off. Sex hormone binding globulin is another big one, because basically these give you keys to what's happening in his body. So say his free testosterone is low, it doesn't necessarily mean we need to pump him full of testosterone. Why are you not making testosterone? Are you making DHT, which is dihydroxytestosterone, which is basically estrogen? So gentlemen that you see with gynecomastia, or what they call man breasts, that can be from low free T. Female infertility, there's quite a bit. Here's the histosalpingogram, HSG. That's the one that they actually test for a lot with endometriosis. I like to do, most of your doctors will do a simple blood test. Like, let's test your estrogen, progesterone, and testosterone through a blood test. Downside is you have to know exactly where you are in your cycle. And ideally your cycle should be, like, if you were normal, then you should be having ovulation between day 14 and 16, which most women that are getting this done are not normal. So they're probably not ovulating at that time. So you don't really get a good snapshot on that blood work. So we do actually salivary testing throughout the entire cycle to be able to see where's your estrogen trending, where's your progesterone trending. I actually had one patient that was ovulating at day 20. So 4 days after what she really thought she would have ovulated, when we started having intercourse later, like around day 18 to 22, got pregnant. We just didn't know when she was ovulating. It worked out. So sometimes knowing these things do help. Anti-sperm antibodies, your body can actually produce these, which kill sperm. That's not good. You know, you don't want to be producing something that's going to take them out. Those poor little devils have to actually swim 3 miles within you. That's basically, you know, if you then you put it in the normal world, it's 3 miles. And they can do it in 30 to 60 minutes. Those little suckers are fast. And they can live in there for at least 36 hours. So what if there's a blockage? They can make it around there. So it's really hard to believe that we do struggle as much as we do. But the other interesting fact that I found as well is that childbearing, or couples that are between the ages of 29 and 34 are only about 20% likely to conceive. And that's if you're healthy. You have no fertility issues, nothing like that. 20% likely to conceive. How depressing is that? I'm like, wow, awesome. So we're lucky. I want to look at it now. Like if you get pregnant, you're pretty lucky because apparently the odds are really low. We also want to look at thyroid numbers. Prolactin is a big one. If I have too high of prolactin, basically knocking out fertility. It's changing how your whole FSH and LH are telling you to actually produce any egg or not produce an egg. Transvaginal ultrasound, this is a very common one that they'll do. They're just basically making sure there's no cysts, there's no fibroids, anything like that. Laparoscopy is another one that we look into. So this is really scary when you look at the research. Mobile phone radiation exposure does also go for ladies. So just because I talk mainly about the gentleman, like if you actually hold it in your pocket as well in the front pockets, you're very close to your ovaries. So you're actually sending EMF in there, and that can actually fragment how your ovary goes down the tube. It can change just the entire mucus in there. So think about that. We are now seeing too that women who run, like with their phone in their bra, you're actually seeing cell phone shaped cancer. Not really a great thing. So it's much more important, keep it on a clip. And when all else possible, don't even have it on you. Like hang on to it, put it somewhere else. Try to not have as much exposure as we are now. Control groups, 50-85% of the sperm have normal movement in testing. The proportion fell by 8% when they were exposed to mobile phones, and similar effects were seen for sperm motility. And this is just exposure, like less than an hour. So if you drop 8 percentage points when you're just exposed to the phone, could you imagine the gentlemen that walk around all day with that darn thing in their pocket? Definitely a problem. Some gentlemen, even it's just as simple as moving to the back pocket. Now, do I prefer it back there? No, because I'm worried about your butt getting cancer. But we'll worry about that later. Let's get the sperm vitality going. They did a 39-year study from 1973 to 2001, and this was pretty concerning to me because over the 39-year period, sperm concentration, so how concentrated that sperm is, has declined over 52%. That's a lot. Now, we don't necessarily know exactly what's at the base of this. So if our sperm counts have declined that much, it's no wonder we're struggling with fertility. And the total sperm count is down almost 60%. So if only 20% of us are lucky to normally conceive, look at what's happening with the rest of us. So could this be diet? Could this be lifestyle? Could this be exercise? Could it be lack of sleep? Are toxins in our world? Absolutely, but we have no idea exactly what's causing this. But this is shocking. If this is over 39 years, the next 39 years, we will be infertile. There will be nobody having babies because we have no sperm. So decreased sperm count has been linked to increased risk for premature death as well. That is the gentlemen with azoospermia, which is they're not producing any sperm, really are at risk for cardiovascular disease. And that actually ties into, is usually with the azoospermia, they have a higher estrogen count. And estrogen for gentlemen is not healthy. It's just like women who have high testosterone, that's not good for them either. Birth control, there is obviously some risks compared to that. Women who have never used hormonal contraception, the relative risk of breast cancer among all current recent users was 1.2. Now the women who have used it was up to 4 or 5%. I was like, oh, that's not so great. But now, upside, they say it does prevent ovarian cancer. Yes, there's one rule, right? Not necessarily a great thing, because now, let's be honest, like breast cancer is on the rise. We're all worried about it, something's going on. So we need to stop adding things in there. Now, mind you that birth control has been around since the 70s, but Roundup came about in the 80s. And we know that glyphosate has a lot of problems with kidney and liver. And if your liver is something that breaks down your estrogen and you struggle with that and you're eating vegetables that are constantly sprayed with pesticides, you may be affecting your hormones just by the way that your liver is functioning to break those down. So we're not sure like what's happening with our fertility because there's too many variables. You can't take one out anymore. It's just not the way it goes. So I picked out some nutraceuticals that I commonly use. Some of these are actually newer because of different research that I found, like calcium D-glucarate. I haven't really used in years. Like I picked it up because I used to do a stool sample test and high beta glucuronidase. I knew that calcium D-glucarate would lower that. So beta glucuronidase is a byproduct of an outgassing of bacteria in the gut. And that's bad bacteria, so intestinal bacterial overgrowth. So we know that calcium D-glucarate can knock that down and bring us back into normal bacteria. Now, the one thing about the endometriosis with gram-negative bacteria, calcium D-glucarate binds to it and knocks it out. So, dosages go anywhere between 500 to 3,000 milligrams a day. Most of the research comes in between 1,500 and 2,000. So when I have questions like we're not confirmed on endometriosis, we're really not sure, but we know we have painful periods, things just aren't working well, this is one of my newer ones that I'm going to move to because I know the gut is off. If your hormones are off, your gut is off. I've got to work with that. The other thing that we do is a lot of times we get to send patients to Dawn and Jamie, who are our health coaches, and we do a lot of plant-based diets, like the Mediterranean diet, anti-inflammatory. Sometimes we'll do Nourish, which is a higher fat, lower carb, but lots of good vegetables in there. Because I know that all the studies that I saw 14 years ago when I started into practice here, that if you changed your diet, your hormones would be different by the next month. Sometimes they're not always perfect, but you are seeing decreases in symptoms. Ideally, cycles should not be what everybody says they are. Like PMS, I'm sorry. Nobody should have that. Nobody should have to struggle that way. Is there a couple hours out of one day that you do get a little moody? Yeah. But you should be able to tie it in and go, oh, yeah, I know what's happening. Sorry, I'm going to go be myself for a little bit because I need to have a couple hours here. Mostly food cravings do happen, let's be honest. If you're craving food, that's a sign of whatever food you're craving is a nutrient depletion that you need. So that's why you crave those foods. If it's sugar, it's usually fat telling you that you want that, so you have a high inflammatory estrogen. But most people during this time will actually start to crave vegetables, and then they'll know, okay, I'm feeling a little better. So chocolate is the big one, and that's usually magnesium. Most women need a lot of magnesium. It's the fourth most abundant nutrient. First one not noticed. So Testotonic, I brought that out. I brought a couple of these out because it's just easier to talk about the ingredients when I have them in my hand. So Testotonic is something I use more for gentlemen. Access Endo and Testotonic I actually use together with gentlemen. And mind you, because I'm a female, I don't get to see as many gentlemen. They're not as comfortable talking to me. So they see Dr. Denver or Dr. Greg, which is great. I'm glad we have gentlemen in the office for them to talk to. But basically, a lot of these, especially estrofactors, Access Endo, these are basically multivitamins along with other nutrients that help to regulate hormones. So Testotonic has vitamin D. We all know that we need vitamin D. Vitamin D is a prohormone. It shouldn't be a vitamin. It's more of a prohormone. It does drive testosterone production. It also has soybean concentrate. Now I get the question all the time, well, I'm not supposed to have soy. They always say that that's estrogenic. Well, it's a selective estrogen receptor modulator. So basically what it does is it binds weakly to that estrogen receptor, and it'll help to keep the inflammatory estrogen off there for a short period of time. So it can help your body to break down that inflammatory estrogen while it's slowly binding. This is also going to have phytosterols, which basically think of these as like things from beans and legumes. They actually regulate blood sugar and lower cholesterol, so inflammatory cholesterol. So, but remember that cholesterol, when it's high, is also healing, so we have to know, is it oxidizing cholesterol from the LDL? Because that oxidized cholesterol basically means your blood sugar imbalances. So we got to work with that blood sugar. We have lignans in here, we have ECGC, oleanic acid, and turmeric. Cool thing about turmeric that most people don't know about, and it's more about the curcumin extract that's within turmeric. Not only is it anti-inflammatory for the gut, but it helps to raise testosterone production or even estrogen production in women. It's whatever's the most productive in that person, they're going to raise that. So women will be estrogen, men will be testosterone. I thought that was pretty exciting because everybody wants to use turmeric, but it's really the curcumin aspect of that does that. So new exciting things. Access Endo, we've actually had in the office for a long time, but it was originally estrogen. They did improve it. They took out most of the sugars, which is fantastic because it tasted horrible. Absolutely horrible. I couldn't get anybody to take it, so I didn't get to use it. It was a wonderful product when people would take it, but now they've actually made it more flavorful. They didn't add they've taken the sugar out. And this one basically, if you look at the ingredient list, it has your vitamin A, C, D, E, and your B vitamins. There's also K in here, but it has the calcium D-glucarate in there. So it has only about 500 milligrams, but it's in there. So it is going to bind to some of those gram-negative bacteria, even if you didn't know you had them. Has lignans in here from flax seeds, because we all know that lignans help to bind to your estrogens that are supposed to be detoxed. So after they're detoxed by the liver, they go into the bowel, and you pull that out with your fiber. So yes, we do excrete our estrogens via urine and feces. So this one also has N-acetylcysteine, which helps the liver. You're going to have some milk thistle in here, some dried melon, carotenoids, which are going to be always helpful for helping to, basically all of these will have zinc or selenium, because that is a building block for your ovary, for your eggs, or for your testes, so that's good. I didn't put Senatol out here. Senatol is probably one of my favorite ones for polycystic ovary, but you do have to do other things to help lower the testosterone. But polycystic ovaries, because of that blood sugar dysregulation, myo-inositol has been shown to decrease or re-regulate that blood sugar. Now, we have had patients that come in that have had a baby with neural tube defects. Well, could that be because they weren't taking folic acid? Possibly. But there's also research that states if you take myo-inositol with folate, and this just says folate, it's not even active folate, it can decrease neural tube defects. So a lot of my women that have had gestational diabetes before with a pregnancy, I put them on this with like my folic acid that is methyl tetrahydrofolate, and I work to prevent that, because I don't want somebody to have gestational diabetes again, because that can also increase your risk for neural tube defects, because you are maybe not having the right nutrients in your body. So, but myo-inositol combined with the folic acid at 2 grams twice a day for 6 months in PCOS patients showed a maintenance of normal ovulatory activity. That's pretty awesome when you think about it. And 72% had a pregnancy, and at 40% during 6 months of the observation time. So that's pretty exciting. So there is hope all the way through as you think about these things. The other thing that we try to counsel patients as they're thinking about getting pregnant is to at least be on, and I didn't put a multiple pack up here either, is a multiple pack, something that has a multiple in fish oil minimum. And I prefer calcium, because ladies do struggle with keeping their calcium balance. Because research has shown those that take a multiple at least 3 months before have a decrease in risk of autism babies. It's pretty good, because autism is right now 1 in 36 and about 1 in 24 boys. So if you can decrease that risk, why wouldn't you try? So, because we all know that becomes a little bit more stress for parents, trying to figure out the pickiness, the sensory disorders, all of that. So CoQ10, big driver for mitochondria. Your uterus and the sperm need a lot of mitochondria. When you create heat in sperm, you actually create a lot of reactive oxidation species, so you need antioxidants, which is why a lot of times they'll actually see vitamin C in a lot of the supplements. But this helps to regenerate sperm and just overall health of a uterus. So CoQ10 is one that most people know about because it's more for the heart. Cardiomyopathies, anybody who's on statins will recommend CoQ10, but it's one of the building blocks for especially sperm and also eggs. Estrofactors, think of this as your multivitamin. If I've had a lady who's been on birth control, this is the first thing I'll put her on, coming off. It's very great at re-regulating the cycle after coming off birth control or any hormone replacement therapy, because it does basically carry your full nutrient protocol with a lot of your B vitamins. So if anybody's done their genetics they know like MTHFR defects are a big thing. CBS defects are another one that can actually change how a woman's fertility is. And COMT would be another one on there. But this has a lot of those nutrients to help with a lot of those genetic deficiencies. So also has the lignans in there, if I remember correctly. Yeah, isoflavones, sorry. Turmeric, rosemary, and resveratrol. Remember the wine. Gotta have the wine. No, I'm just kidding. Always anti-inflammatory. So the other one that I did bring out that I didn't pull up on here is because I do have a lot of ladies who I talk to and I'm like, so how's libido? And I get a lot of, and I'm like, really? No libido? What's going on? Like, I've never really had anything. I'm like, oh, okay, so we've been damaged. So FSH and LH aren't really working really well. How's your cervical mucus? I'm like, ooh, that's not good. Because that prevents us from getting infections. Like, you don't want to not have a good cervical mucus. Plus, that's also, it's kind of like the swimming pool. It allows the sperm to find their way, right? So if you don't allow them to have something to swim in, they basically are stuck. So this one has been a wonderful thing for my menopausal ladies because they do get vaginal dryness and they have poor libidos. But I do use it in my younger ladies as well because I can balance out FSH and LH and help them with libido. Because if you're spiking your libido, that means you're actually having a surge in your luteinizing hormone and you're starting at ovulation and hey, things are starting to work. So really good changes could happen. So it could just be a lack of the building blocks aren't there. But then that goes back to looking at, is the thyroid working well too? So, all right. So I think, building blocks, I covered zinc. And zinc is actually in testotonic, it's in ester factors, it's in axis endo. So there's a reason zinc and selenium and all those are in there is because the building blocks are that important. Most people don't get enough zinc in their diet. Like when you're sick, if you're with somebody who gets sick more often, you're probably running zinc depleted. Gentlemen don't necessarily get sick as much, so it's a little harder to kind of feel them out. But, you know, if you think about it with the ejaculate and losing your zinc for the day, if they're not eating a good Mediterranean diet every day and they're eating the standard American diet, which is terrible and has really no zinc in it, they're just running off whatever's left in their muscle mass. And over time, your muscle mass will piddle out and there won't be much left. So then you're basically run with bad swimmers and sometimes no sperm at all. So important things to think about. Food, another very big one. I did not put a lot about food in here. I know I've talked a little bit more about food. A lot of patients I do recommend actually starting on an anti-inflammatory protocol, which is basically taking out dairy, gluten, soy, corn, citrus, peanuts, what else am I missing? Sugar and eggs. Got them. Okay. And the reason why is because a lot of people actually have one of those. It's a sensitivity. It's not an allergy. Doesn't come up every time you eat it, but it could be 2 to 3 days later. Or you could say, like I run into a lot of people who have ice cream and they'll say, I get a little small stomach ache. I'm like, okay, then you're dairy sensitive. No, I just have to have the lactose free. I'm like, no, you add dairy with sugar and things go ugly. So I encourage them to take dairy out for three months, add it back in and see if you have a side effect, and a lot of times it'll show up. But your body's a wonderful, wonderful machine. I don't even want to call it machine because machines don't work as well as our bodies. They adapt, and they will adapt to our environment. Our environment is changing so rapidly that our body has not had the ability to adapt. That's why we're starting to see things like the sperm concentrate going down. Fertility rates have dropped by 13% since 2007. So we're just slowly declining, and we don't really know why, but we do know that there's a lot of things that we can do to correct it, and then our own environment is the first place to start. You can protect your home, and you can do things in your home, and you can protect what you put in your body. You may not be able to protect yourself outside, but all those things that you do at home where you spend most of your time can protect you fertility-wise, and hopefully help your baby be a nice, healthy baby. You know, that's really what we're focusing on. So, any questions? That was a lot, I know. I was like, I packed so much into this that I probably overdid it. But I really wanted to get as much on the men as possible because the men don't really ever get nailed. Like, I mean, I get a lot of people coming low sperm count. They're fine. I'm like, no, they're not. I get it, in vitro is easy for the doctors to send you to, but it's super expensive and it hurts the woman's body. So what can I do to help these men out? So if you have one of those, encourage them to think a little farther in. Any questions? Yeah? Yes.
So what amount of alcohol would affect the mortality of the sperm?
You have to truly be an alcoholic.
Oh, okay.
Yeah, usually they say about 5 to 6 drinks a night. Okay. Yeah, so 1 glass a night or even, a couple a week, not going to affect that morphology. Unless, of course, you have a non-alcoholic fatty liver already, which comes from blood sugar dysregulation or other environmental factors, then that might raise that. But I can't say that because I haven't seen the research, and I probably haven't really looked that deep to try to find that one. So, anything else? Yeah.
You mentioned like mold and alcohol.
Mm-hmm.
Is that something that is worth doing like a mold testing thing, or does it?
If you see it, like most people, if they know they have condensation and you can see like any black spores, like especially in your bathroom, if you look around the caulk in your shower and you have some black spores in there, you're more likely have mold. Now, it's very hard to get rid of, so they do require remediation. Bleach doesn't do it. But there is a wonderful product out that does actually arrest the mold ability to grow, which is called Homebiotic. If you go to homebiotic.com, it kind of explains it. It's a plant-based, soil-based. And basically you spray it around all the areas that would have moisture, and you can help to prevent the mold from growing. Now, will it kill what you have there? I can't say that because they still recommend remediation. I just had one of my patients that they had mold in the house. So like if you have mold in the house, you have mold in all of your books. So all the books get to leave. It loves paper because it's going to be hard to get it out of everything. Like you almost have to pull up carpets and everything. So is it good to test for? Yeah. But they say 70% of our houses and our businesses actually have mold because we're not working on our circulation. We've cut, you can decrease your building costs by doing different things with your circulation, but then that is also allowing it to get moldy. So important to at least look at, because more and more times I think I see fatigue and energy issues with ladies or even gentlemen, and I root around a little bit and they're like, oh yeah, like this time of year we've got, I can see it underneath my blinds. I'm like, oh boy, that's not good. So it's no wonder why you get worse in the winter. So in the winter, we're all locked up. We have our heat on, and a lot of us have humidifiers going, so you're just allowing it to grow. Okay? So, anything else? Yes?
So with the mold, I know that like in our house in particular, we've got a couple of areas, especially around the windows, that just pulled out our shower last week.
That's ugly, isn't it?
So, I mean, how long, because we've lived there for 4 years, so exposure-wise, what are, like, detrimental, like, how long does it take to, like, even partially reverse some of the side effects that we're seeing from that? Like, I mean, how far up the creek are we?
Well, and that's a hard thing to answer because it depends on each person. It's different. It could be months and it could be years. It also depends, can you get it completely out of the area? And if you don't, then you're always living in it. But one of the things they say is you really have to remove yourself from the mold to be able to get that toxin level down. And then a lot of times what we do is a mold mix, which helps to bind to spores for you so then it can prevent you from having the reaction. Boosting your immune system, mitochondria like CoQ10 really becomes big here because mold will actually deplete your mitochondria. So really stimulating things will help to build the mitochondria, which Doc talked about last month. So he had a lot of good information on his seminar last month with that. Because it could be just as simple as getting it out a couple months. You guys are right on track. Could be years. So a lot of times they are now questioning that patients that get diagnosed with Lyme's, is that actually mold or Lyme's? And they don't know. But so yeah, that at least you found it. It's a good thing. That's the way you have to look at it right now. Be positive. Anything else? Yes.
What was the supplement you talked about it?
Oh, it's called Her Synergy. So HER and then Synergy. Yeah. So interesting. Good stuff. And thanks for coming, guys. And we will see you next month. I don't even know what next month is on. I forgot to ask. I'm terrible. Sorry. Watch YouTube.